Mr. David Lynch. And we had a meeting today, a special virtual executive council meeting, in which he was in attendance, as well as the chief medical officer and the permanent secretary of health. And a number of measures were agreed to. These were published earlier via press release and social media outlets. But for the avoidance of doubt and clarity of our expectations, I would take this time to reiterate the following. As of tomorrow, 27th April 2021, essential services will be open between 6 a.m. and 4 p.m. only until at least the 6th of May. People should exercise only within the boundaries of their own premises. If this space is communal or shared, safe social distancing should be observed. The following activities are permissible: visiting your doctor or pharmacy or to get vaccinated, to buy food or fuel, and we recommend using those facilities nearest to your district, and to make use of banking services. In terms of fishing, those fishers who are licensed and have GPS trackers on their boats are allowed to fish between the hours of 6 a.m. and 4 p.m. daily. Fish on the north side of Anguilla, which means no fishing between Anguilla and St. Martin. And you're expected to leave from and return to the harbor that you are registered to. Farming also, farmers will be allowed to farm between 6 a.m. and 4 p.m. Both farmers and fishers will be able to sell the produce between those same hours, and will be allowed to sell to local groceries, restaurants, and also will be able to do from their usual spots. However, there has to be safe social and physical distancing, which means those buying fish and farm produce will do it from their cars. I will now ask the Chief Medical Officer from the Ministry of Health, Dr. Aisha Anjuan, to provide an update on vaccinations and the COVID response to date.
Good evening. Okay, so today, as of 3 p.m., we have confirmed 52 cases associated with that cluster that was identified on the 21st of April. And that is after having screened and tested 900 persons. The cases consist of 47 adults and 5 children. And today's screening included an additional 20 school children who tested negative. At the time of writing, we have not had any hospitalizations or deaths, and all have been instructed to isolate. So we want to reiterate that those persons that have been instructed to quarantine and isolate need to strictly observe those instructions. That is the only way we can safeguard and prevent this situation from deteriorating any further. As of note, this morning I got official communication from the World Health Organization that our category or status has been changed to cluster of cases, which means, and people keep asking the question, so I'll explain again, the cluster is defined as cases detected within the past 14 days, predominantly limited to well-defined clusters that are not directly linked to imported cases, but which are linked by time, geographic location, and common exposures. So we still meet that sort of criteria, those criteria. However, World Health Organization goes on to state that it is assumed that there are a number of unidentified cases in the area, and this implies a low risk of infection to others in the wider community if, and I repeat, if exposure to these clusters is avoided, right? So that if exposure to these clusters is avoided is reinforcing what we're saying. We need to contain the situation, but the if, people need to comply. People need to understand that when we give these instructions, they have to comply with our measures. We need to restrict movements. And in the wider community, we understand that we will have possibly missed some cases just based on the nature of the events that led to this, in our humble estimation. So the rest of us also need to restrict our movements if we are to prevent progression to community transmission. That, as the Premier mentioned earlier in the opening, was the reason why we decided to, or we have advised to ratchet up the measures, especially for the next 10 days. We can have this. We need to batten down the hatches, and we need to lock down, and we need to restrict our movements, and we need to be responsible and to cooperate in these efforts. So we cannot emphasize that enough at this time. We have not declared a state of emergency. I'm begging people to act like it's a state of emergency. From a public health perspective, it is, right? Let's behave like we're under curfew, and let's be responsible. We don't need anybody to tell us that, right? This is critically important. That said, in terms of the vaccinations, and we have said that vaccines are the way out of it, I will share that we have done some quick and dirty assessments of cases that were persons that came in between the 23rd and yesterday, the 25th, looking at a subsample, a subset of 500 and odd persons that were screened. We had 524 negatives and 100 positives. And of those, we're noticing, 524 negatives and 28 positives. We have noticed a pattern whereby the percentage of persons that are vaccinated among the negative cases is much higher than among the positive cases. So, for example, in that subset of 520, that's 553 persons tested or screened for that interval, we saw like 48% of your negatives had at least gotten one dose of the vaccine, and only 14% of those 28 positives at that time had received at least a first dose of the vaccine. Besides that, we're getting reports from persons that in households where you find that the persons who have gotten the first dose were incidentally also the negative persons. Again, we have seen from the larger countries, the bigger, more robust data. This is not news, right? We've seen in the UK where the vaccinations with the first dose have reduced transmission of this virus by 65%. And with the second dose, 80 to 90%. So we knew it, and now we're experiencing it, unfortunately. But we are seeing that. So what we are seeing in terms of vaccinated versus unvaccinated, in terms of positive versus negative, it is quite in line with the data that they're seeing internationally. So again, we cannot sing the song enough for vaccination. In terms of where we are, we have 7,260 persons now registered on the portal. Of those, 6,402 have received at least a first dose, and 1,685 have received a second dose. That puts us around, it was 60 to 70% of our target population, but that's only still shy of 50% of the general population. So the numbers are looking up. People are taking the vaccine more, but we're not where we need to be. I also want to share that this morning we sent off samples to the Caribbean Public Health Agency to send on to the University of the West Indies for genomic sequencing. So in a few days, we're going to know what strain of the virus we are dealing with. So I'll leave it there for now.
Thank you very much, Premier. I'm still in a room with some of my staff who are giving me some support on issues, so that's why we still have our mass social distancing. Just in terms of the vaccination move, we have determined that it's in the best interest of the vaccination program to change the site for the second doses. So from tomorrow morning, the second doses will be administered at the Ronald Webster Park, not at the Football Association, and it will be administered while you're in your car. It will be a drive-through process. You'll drive through the eastern gate of the Ronald Webster Park, that's close to the volleyball court. You drive around the cricket field in a line that will be marked out. So you'll indicate there how you'll be marked out. And then on the western side of the park, go under a tent, and there will be nurses there administering the vaccine while you're in your car, and then you will leave. We will no longer be doing second doses at the football stadium for a couple of reasons. Firstly, we are in a state of clusters, and we want to reduce contact of persons from different households as much as we can. So we will no longer be doing second doses at the Football Association stadium. We will be doing second doses only at Ronald Webster Park in your car. You'll drive around, you drive under the tent, and you will be given your dose while there through the window, and then you will drive off. All documentation will be given to you at a later date. We have indicated that this is critical at this point in time because of the local situation. First doses will still be given at the football stadium. We will have more chance now because we're now doing second doses there to spread out the first doses so we can social distance properly, so that we can have more space between persons to do the first dose there. So first doses still at the stadium, second doses at a Webster Park drive-through. You will have persons there indicating and directing how you should drive through and directing you how to go under the tents to get your vaccination. So as indicated before, this is in line with our drive to have persons not congregate, to have persons of different families not to mix, to have persons from different districts in the community not to mix, and to keep people moving rather quickly so that we can get the country vaccinated in a very safe way. Thank you very much, Premier.
Thank you very much, CMO and PS. You stay around. We'll have question answer later. Right now, there was a question asked about construction. All construction will have to cease for the next until May 6th in the first instance. I'll ask the Commissioner of Police to speak to the surveillance and also enforcement of the regulations at this time. Thank you, Mr. Lynch.
Thank you very much, Premier. Yes, since Friday, initially on Friday, we were gathering information and encouraging people who maybe hadn't either heard about the regulations or was not quite willing to comply with it. But from Saturday onwards, we took a much firmer stance. And on Saturday, we started doing vehicle checkpoints. And on Sunday, we've done that. We've also reformed the Iron Dome Border Force tripartite team, which is customs, immigration, and the police back together to try and make sure we protect the borders. And we're just in the process, and hopefully tomorrow we'll have one of the boats back in the water, so we'll be able to intercept any boats that are moving around. And just to echo what the Premier said about fishing, it's only on the correct side of the island, and it's got to finish at a specific point in time, and the boat will be there to make sure that happens. But overall, my overall assessment of the situation was compliance by the public was very good at the weekend. We'd seek their support, but our role here is to make sure that we do encourage people to comply with these regulations, because as the Chief Medical Officer said, it is crucial to stop the spread of these diseases. If people do not, then we will take enforcement action, and we'll encourage the court to process them as early as we can to make sure people feel the strong arm of the law and the sense of justice very early on in this process. Thank you.
Thank you very much, Commissioner. At this time, Minister Kenneth, are there any questions?
As of now, no, but the media in the room, so the media. There's a question, Premier, about the list of essential services. It may be useful to run that list again, though. The list of essential services.
Well, what I can say, Premier, what I can say with regard to that, there will be a more detailed list coming out in the regulations. We're now working on that, and I think we should await until that comes out properly so people can be fully informed on that list of essential services. It has been reduced compared to last time, but we're making sure that all the correct essential services are covered.
Okay, so we go across to Felicia Hennis, ready, Angola.
Good afternoon, Mr. Rogers and Dr. Endrin. Persons are wondering why a notice did not go out probably from Wednesday evening when the authorities may have had the information about this possible case.
Well, we have said before, it came on the evening actually, and we always have to do our investigations before we alert the public. That's just how it is. There's always a delay before we can give information, because we have to know what we're talking about before we come across to the public. But I believe that was given the very next day. And further to that, there's a 48 hours that even WHO gives us to report, which we have been doing, but it's about investigating. So we can't talk about what we don't know about, in short. So we put a rush on finding the information. We got our first 3 confirmed cases that very evening, and then we were able to tell the story. But we can't tell the story and advise folks if we don't know what's going on. So we have to come to you responsibly and with as much factual information as we have, and that invariably takes time.
Okay. As it relates, we know notice went out to parents today for the children to be tested tomorrow. I'm just wondering, for those who have been tested, will they be retested later on?
Well, actually, part of this thing is ascertaining who are contacts. We imagine that there will be in a 14-day period, but right now we're doing a very broad sweep. Actually, we've really lowered the threshold for testing for the school children. We are just including everyone who could ever possibly have been exposed, even if they're not bona fide contacts. So we're going to have to tease that out a bit more. What we're doing now is prioritizing real contacts and also having a sort of broad-based wide net when it comes to the school system. So they'll be contacted in due course.
Okay.
James Harrigan here from the Anglican newspaper. We closed down until the 6th of May officially. What kind of conditions are you looking at that will indicate that it's safe to reopen after the 6th of May or just after the 6th of May? What landscape will be looking like then?
Well, that's a very good question. And one of the things depends on, in terms of the contact tracing for the cluster, we will look beyond the last confirmed positive case coming from this cluster. And then we're proposing 2 incubation cycles after that last positive case. That's roughly 4 weeks. But it's a bit premature to discuss when we start looking at relaxation. Right now, we need to get out of this, but that's what we project that's going to happen. It's a large cluster. It's an extensive cluster. So we're looking at the last positive case coming from this cluster and taking it from there. So hopefully in the next week or not too far beyond, we'll know who that person is, and then we can plan going forward. But we are proposing all things remaining equal, looking at 2 incubation periods after that last positive case. And we'll discuss any measures in between subsequent to that, but we need to get out of this crisis. So we'll wait for that.
Okay, can you please explain again for us, just for clarity's sake, what is the difference between the community spread and the cluster?
The cluster has linkages. The cluster has linkages in time, in space, geography, and in terms of common exposures. There are links between the persons we have identified with the index cases identified, distinct links to date. The moment you start to see persons popping up that have no links to this cluster, and the moment you start to see rampant disease, you're looking at varying degrees of community transmission. And you will note that WHO, we're working on international standards, so it's no surprise that that was corroborated this morning. They officially changed our classification to clusters and not community spread yet. And we cannot impress upon the public enough that we do not want to descend into community spread. So once again, persons identified, specific exposures, and we're still seeing those positive cases linked to those. So it's still a cluster, clusters. The moment we start to have people popping up all over the place with disease that have no link to what we are seeing, that's a problem. Then you're talking about community spread. And they're going to be varying degrees. There could be 1 or 2 cases, that's a level 1. If we have rampant infection, that's a level 4.
And that is our concern right now, members of the media. We are very concerned that the movement among Angola is conducive to level 1 community spread. We have to stop moving around Angola if we don't need to. There is no reason to be leaving house if you don't need to, except for essential services and vaccinations, and then go back home. Because if you move about the country too much, then there's a possibility of what we call tertiary infections. Then there's a possibility of us not being able to link the positive cases to exposure. And once that happens, we then are in a different category altogether. So I think as of now, we can still link every one of the cases to those exposures that we identified a couple of weeks ago. We can link everything back to there. From the time it starts to a point we can no longer do that, then it's a different category of fish. It's a different kettle of fish, or it's a different category altogether. So we're asking people to please, and I can't stress enough, do not move about if you do not need to move about, because then that is why the system can crumble, because then we get the virus jumping all over the place, and we can no longer link the virus and the positive cases to those exposures that we know about.
And further to what the Premier has said, so the PS has said, make no mistake, this is a bad situation. We're on the brink. This is an extensive cluster. It's a cluster nonetheless. We're not going to hang on the semantics. We're fortunately not in that community spread categorization yet because it has repercussions internationally. Make no mistake, let us act like it's the community spread already. Let's act like it's a level 4. That's what I'm saying to you in practical terms. We're not there yet, but it's that precarious because of the extent of the cluster. If people move around, we're going to be in trouble, okay? So yes, it's a cluster, but it's a bad cluster. It's not a cluster of 10. It's not 2 households involved in this cluster. It's a cluster of 52, and it's extensive social networks, even the school impacted and so on. So far, no positive cases. We're on a very slippery slope at the moment. So if in the minds of people, you want to believe we're a community transmission, I would say for the purpose of this exercise, let's think that. Because if it brings about the persons complying with our measures, then the objective is served, right? It's a big cluster, it's an extensive cluster, it's a scary cluster, it's not good, right? We're not quite at community spread yet, but what we do in the next few days will determine that. That's why it's such a dire situation and an important moment. We're saying that's why we're talking about a further lockdown. Even using the words lockdown, I think that's what we need to do in principle, and everybody needs to take that on, and everybody needs to act like they're in quarantine, quite frankly.
Okay, before we take the next question from Brenda, just to make a point for some of the concerned viewers, the Premier does not have on a mask. The Premier is in his office by his lonesome self. And so just want to make that point to our viewers who are wondering. The Premier is in his office. All the IT guys are in their one office. So yes. A question before we get to Brenda, to the Chief Medical Officer. Someone wanted to know, other than quarantine, what recovery methods are recommended for those who have tested positive, and particularly for those who are symptomatic?
Hinge on a very important point. At this point, there's no specific treatments. Treatments is supportive. The best thing people can do is remain under quarantine so that this virus does not have warm bodies to spread to, even more than the mask wearing. Stay put so the virus can't jump from person to person to person. If your persons who are symptomatic with aches and so on, is going to be supportive, it's going to be Tylenol and hydration. And God forbid that anybody gets ventilated, because it's going to be things like steroid and ventilator medications associated with that support. So yes, it's a virus with no specific treatment. Thanks for the opportunity to reinforce that. No cure, and the treatment is supportive. So now most of the persons, or nobody is hospitalized. There's a possibility that persons can deteriorate in the 2 weeks, God forbid, but that's what we're holding on to at the moment. But the more cases we have, the more likely you're going to have people very ill, the more likely you're going to have people hospitalized, and then we're in a worse situation.
Thank you, Chief Medical Officer. We go over to Brenda Carty of the Herald newspaper.
Good afternoon. Following on from the Chief Medical Officer about everybody staying put and so on, I would like to know what the fines are, first of all, for not wearing a mask, secondly, for unnecessary travel that is not considered essential, and thirdly, for illegal entry, if that can be proved.
Yeah, the fines under the Public Health Act range all the way up from a couple $1,000 to as high as $38,000, depending on the infraction and including prison time.
Okay, thank you, Brenda. Are there any further questions?
Mr. Rogers, some sense of ambiguity is there with the wearing of masks. You said on Saturday morning that from the time you leave your house, you should put on your mask. Is it necessary to drive with a mask even though you're driving alone?
Mr. Harrigan, I think there's a lot of technicality that people can bring into these issues, which is sometimes I wonder really what is happening. We are in the middle of a pandemic, and I think if people can find that the only thing they can make noise about is whether we wear a mask or not in a vehicle, I think it's a little concerning to me. I think what people should realize is that the issue of masks is a protective measure to ensure that if you are positive, you don't pass it to someone else, or that you're negative, you getting it is decreased. So I'm asking people to wear the mask. Whether police is going to prosecute you for wearing a mask, not wearing a mask in a car or not, is questionable. They probably will not prosecute you. They probably can't prosecute you. But I think it goes beyond that. Let us understand what's happening here in Angola. We have 51 cases of a virus in a country that is 60 miles long and 3 miles wide. That is not the total number of cases in the country. The statistics will show us, and the WHO will show us, once you do surveillance, the numbers that show up in your surveillance cases is not the true number in your country. I can guarantee you, by tomorrow we're going to have more positive cases, because that's just the way this works. So once we get to the point where we start to bicker about whether wearing a mask in a car or not, I think it's besides the point. I think we need to ensure that we try to follow the rules and the guidelines. Once you're outside your house, wear a mask. If you're in a car by yourself and you want to wear a mask, wear a mask. If you're in a car by yourself and you don't want to wear a mask, don't wear a mask. I mean, it's gone to the point where it's getting so ludicrous that you wonder if people realize that we're in the middle of a pandemic. So I'm asking people to please stop hanging on these little intricacies and technicalities, and understand it is a dire situation in Angola, and we have to come to grips with it and try to, as much as possible, to stop moving about the country, stop jumping from here to there, try to stay at home as much as you can, only leave if you have to leave for essential services, and wear a mask as much as possible. Thank you.
I asked that question is because I myself got a question recently about one exercising in his backyard, wondering if he should wear a mask. So that's why he said it's a sense of ambiguity, in the sense that we don't know. Granted that the virus might be in the atmosphere, right? And it's safe, it's not safe to put on a mask. I'm not saying that. And I'm not condoning a person who don't put on a mask. But Angola is an age now with the rest of the Caribbean and the world, and the wearing of masks, we have proven is essential. But even exercising in the backyard, I think a mask is kind of uncomfortable, or is it necessary?
I agree with you, and that's one of the reasons why we have never moved to this mask mandate until it was absolutely necessary, because we know the difficulties and the intricacies of masks. And that is why we have, for the last year and a half, have resisted the push. I mean, we have been pushed for wearing masks for the last year and a half, literally being pushed at different levels. People in the community, people at different levels, and we did not do that because we know the difficulties of masks. And masks are the last point of resort. It is not something that you do give you a sense of protection. But what I'm saying is, let us try to wear our masks as soon as we are off our premises or into the public to protect ourselves and other persons.
And further to that, let's keep the principle of the thing that kept us safe and can still keep us safe, with the quarantining, the border closure initially and quarantine thereafter. You need to prevent the warm bodies for the virus to jump from person to person. So even before that, just stay home as much as possible, and that if you go out, you wear the mask. But the main thing is to restrict the movements, even up to now.
Okay, I have a question, and it relates to the whole concept of essential workers. This person looks after the elderly father who lives in a different location. The person wanted to find out, because they would have to visit their father at least twice per day. Would they be considered under the essential list of persons, or is there any special consideration being given to persons who have to care for others in different locations?
Certainly, that is similar to as a caregiver, similar to a healthcare worker. So yes, that's an essential function.
What we'll ask persons, if you're going to be moving back and forth between your home and your father's home, just make sure that you follow the necessary precautions. But certainly, that person will be considered an essential care worker. The elderly in our community is critical for us to take care of them, and it's not everybody can have a person living in-house for the elderly parent 24 hours a day. It's just not possible. So yes, we will certainly accommodate persons who are moving to take care of their elderly persons. but we'll ask that you do it very carefully, and we'll ask that you do it very responsibly.
Thank you very much. So we go over to Dawn Hodge. Dawn?
Hi. I have two questions. One is for the very hardworking health team. I really applaud you. And I just have one quick question for you and then one for the commissioner. In terms of the outbreaks on the island, is it fairly spread throughout the island, or are there pockets where there are more cases than others? Is it confined to particular areas or evenly spread throughout the island?
What we've noticed is a pattern linked to the exposure, not where people live, linked to the exposure over a few days, a few social events. So we're looking at that information, and we're going to try to do some GIS tracking, and that becomes more important when if this thing evolves and gets out of control. Right now, we've been tied on with the contact tracing, to be quite honest. But right now, we've been seeing a link in terms of exposures more than geographic location. So we're not putting much stock in the geographic location right now because they're still linked to the cluster. But that analysis is coming as well. But what this is stark analysis is showing specific exposures and the exposures and linked to those exposures. So that's the pattern we're seeing more than where people are located, the exposure to certain events.
Okay, thank you. My second question is for Commissioner Lynch. I am so glad that you're on this conference because there are lots of questions swirling throughout the island about the source of the introduction of the virus to the island. It was specifically said at the very beginning that it was assumed or proven, I'm not sure which, maybe you can clarify that, on a re-entry of a person or persons. And again, you know, this is a small island, a lot of speculation. I know that you can't address the who, but the what and the when, and just circumstances surrounding the introduction of this virus to Anguilla. Could you speak to that?
I can't really speak to that at this point in time. I think the question may be better answered by the actual health team than by myself.
Well, that's right. That's fair, because what we are stipulating is that based on our public health investigation. So let's back up a little bit. Many months ago, we had established, like several other Caribbean countries, but certainly for Anguilla, through the evolution of this crisis, that we knew that our biggest risks of importation would be from persons coming in and also from the borders, right? We knew that the border risk would be compounded by the Iron Dome sort of run out of resources, as we knew several months ago. Further to that, we know that in terms of the so-called bubble activities and the imported cases that we have confirmed, we are certain in terms of our contact tracing, we did not have any links with any persons involved and any persons who have been confirmed positive, no imported cases confirmed positive at all, right? So that there was that. There's also a background surveillance that is continuing and has predated COVID. There's communicable disease surveillance. So we have ongoing syndromic surveillance and we have sentinel surveillance in terms of persons that get admitted to hospital, particularly with severe respiratory symptoms. That has never stopped. We've tested those and so on. I say that to say we look for clusters, we look for persons with illness, so that if this was an insidious sort of thing creeping up, we should have seen that with the surveillance. We report to CARFA and international bodies every single week before COVID. That is ongoing, right? So those signals were not there. And that's something that we do all the time. And further to that, we also test persons going overseas. But there were two big arms in terms of where this could have come in. Further to that, we got confidential reports and reliable reports that, well, of course, we can't disclose who, that tied certain activities with what we were seeing. So we're not a law enforcement agency. Our objective is sort of to identify sources for the public health protection and the public health interest. And that is why we said it is most probable. These were clearly the two main risks of importation, and we had ruled out one. We knew the evidence that showed that would not have supported an insidious creeping up of this thing. We knew this is an acute explosion that tied into the sort of quote-unquote public health intelligence we were getting. And so we were convinced that and even the onward contracts and transmission were consistent with the reports we were getting. Again, not from a law enforcement perspective, purely public health, because we want to know where the virus is being introduced, because that's what we do. We protect the public health. If we need to address certain areas in certain ways, we need to address those things. And recall also that these so-called bubble activities, by and large, persons going back to the States are tested again. So they're testing out no identified linkages with known cases from the so-called bubble, and then the public health intelligence and the background public health surveillance that has been ongoing before COVID. So it was a constitutional thing that we can say with certain confidence, probabilistic speaking, for the sole reason of stopping anything like that from occurring or from propagating. So that's what we were saying.
Mr. Rogers, you had earlier announced the new system for vaccinations for the second dose. A question came in concerning the testing at the Ministry of Health for students and staff. Can there be a similar drive-through procedure for testing to reduce the risk of transmission while hundreds wait to be tested?
No, I mean, right now we have to deal, remember we did it with a whole team and a whole logistics and even real-time data collection, collation. There's a whole team. We have call control management. Thus far, the team is, the persons that are on the ground dealing with it are saying that they would rather operate as we have. It's been working well. There's also some screening going on at the hospital. So what we're doing in terms of considering a drive-through kind of mechanism is for the vaccinations. What we're doing for the screening, and it is winding down actually, has been, the folks on the ground are happy with the logistics. So there's a whole chain of logistics with the interviewing persons, with the data entry, the actual test, the results, and also linking it to the surveillance team. And the team prefers to remain. And they're quite satisfied that it's working. And the social distancing and the crowd control is in effect, and mask wearing.
Okay, thank you very much, Chief Medical Officer. Before we go to Brenda, we have on the line.
Yes, good afternoon to you, class of Hammer here. In terms of the numbers, we are witnessing a steady increase, really. They're up now, 52. What happens if we continue trending upwards? That's the question I have for you. What will be our next step, in this process?
Well, what we are seeing now is with the results of the contact tracing. There's a very important distinction to make. What we'd be more concerned about if it starts to link outside the immediate cluster, what we are seeing is not too surprising. The most important thing right now, if we maintain that link, it would be more worrying if we get outside the link, right? So steady increase, but you would have seen before, after the surge of the first couple of days, we actually have not been seeing, it's been like a slow trickle of fewer than 5 cases per day more. And sometimes what we say from 3 p.m. every day, sometimes we do get cases in the evening. So it's not really reflective of a surge the next morning. So you have to bear it in mind. Every time we say it's current up to 3 p.m., we get a couple confirmations, then it will only be reflected on the next day. So we're watching it cautiously. And again, the most important thing for this is for persons to stay home, restrict movement and so on. We will know in a few days where the contact tracing is taking us. Right, but the most important thing is the nature of the exposure, and if we see it really move outside the cluster, that's going to be much more worrying than the actual numbers right now, which to our estimation in terms of the number, the proportion of the positives to how we are screening, not yet alarming. Right, the denominator is growing much bigger than the numerator at this moment, but we're definitely watching it.
Okay.
I'd like to add on that, before you, I'd like to add to that. That is why all the positive cases currently, and also all the other persons who have been asked to isolate and to quarantine must isolate and quarantine, because we're asking them to stay put so that they do not ramp this up in a way that spread to other cases. So if it gets out of hand, like the Chief Medical Officer indicated, that's a whole different ballgame. But we're asking persons who have been asked to isolate, whether you're positive or not, because there's some persons who've been asked to isolate or to quarantine even though they're not positive because of the exposure. Some people will not turn up positive until a couple of days after. So we're asking persons, once you've been asked to isolate or quarantine, please isolate or quarantine and do not leave your homes. Now, the Ministry of Health through the bubble, we were able to inspect every house. We were able to inspect the accommodations that people were staying in. And when persons showed up positive there, we were able to ascertain for certain that they were isolating properly. And some cases, these villas and so forth had security guards so people couldn't leave. In this case, we have over 50 persons in the community. We were not able to check their households. We can't, because certainly in the middle of a spread of disease, people are going to be home. So we do not know some of the conditions under which these persons are living. So what we are saying, please isolate. You will not have a security guard next to your house. You will not have a police in your yard to ensure you don't leave, but you have the personal responsibility to ensure that you do not spread the disease by ensuring that you follow the instructions of the health team to isolate or to quarantine based on what instructions you've been given.
Thank you. So we go across now to Brenda and then Felicia.
Sorry, Ken, I didn't have my hand up.
Okay, so we go to Felicia.
Okay, just a couple of things, Dr. Andrew. I'm just seeking clarity on something when you gave the latest stats. You said 47 adults and 5 children, and then you said there are no positive cases in the school. The 5 children, aren't they going to school?
I was clear that remember we said that the surveillance had expanded to the school system. So the contacts, the children that were identified previously are linked to this cluster. So naturally, as part of the cluster investigation, we included the school system. From those contacts, in the potential contacts among children in the schools, we haven't gleaned any positives. Potential school children contacts of the positive children, no positive among those. The positive children we have are linked to the cluster, to the parents' activities.
Okay. All right. Okay. As it relates to the vaccination program, you said that things are progressing well. Do you think we will achieve herd immunity?
We better achieve herd immunity. Do we have a choice? I mean, really, at this point in time, that's up to you, me, everybody else here. I've done my part. I don't know what to say, quite frankly. That's up to you. Tell me, Anguilla.
Yeah, I think we hope to get there. Angola is in a fortunate position. It's one of the few countries in the world where there's vaccines sitting in a refrigerator at the local hospital that everybody who needs it can get it. There's no other country in the world that can boast to that. There's enough vaccines sitting in a refrigerator at a hospital that everybody who needs it right now can get it. So I think what the chief medical officer is indicating, and you can sense a level of frustration, because basically, if you have listened to the numbers she indicated before, of those negative cases that were determined out of the 900 and something tests that we've done, the bulk of them had already been at least had their first dose. So the evidence is clear, and this is being seen all around the world. I mean, in England right now, because of the massive drive of vaccinations, the cases have dropped so precipitously that now COVID in the UK is almost being considered endemic. It's no longer considered a pandemic in the UK because it's at a level where it could be considered an endemic or normal. So we have the evidence that vaccinations can help. They can assist all over the world. In fact, if you look at what happened in Michigan right now, the cases that are ramping up in Michigan are no longer the people who have been vaccinated. It is no longer the people over 50. It is no longer the elderly. It is not the younger people who have not yet gotten their vaccinations or the younger persons who have decided not to get vaccinated. So if you look at the cases right now overrunning the hospitals in Michigan, it is people in their 20s and 30s who have either not yet been vaccinated or who have refused to get vaccinated. So the evidence is there. So when people tell you that there's no evidence that vaccination helps, you have to ask them, which jury are they listening to? Got to be a kangaroo court.
So we have 4 more questions. We will take the Anguilla newspaper, Dawn of the Herald, DJ Hammer, and then we will finish with Felicia. In that order. James?
Yes, James here from the English newspaper. Before I make my question, I want to make a comment. I want to really applaud the sincerity, the work of the health team and the Secretary of Anguilla, Mr. Rogers, Ms. Andrew, and all who work along with them. I want to say complimentary congratulations to you for the control that you have on the situation. And we trust and hope and pray that it will be indeed controlled in the course of the next week or so. My second question is not just for my sake, but for the sake of those who might ask. It's in connection with the vaccine, and Mr. Rogers may be able to answer this. The first dose will have certain ingredients in it. The second dose, is there a difference in the ingredients of the second dose and the first dose? Or are they the same ingredients?
It's the same ingredients.
Okay. Because the reason why I ask that is because sometimes we call it a booster, and I was wondering if there's certain enhancements to the second dose and the first dose. That's maybe it's a redundant question, but I just wanted to know.
No.
Okay, so we go across to Dawn.
Yes, my question is just a numbers clarification question for Dr. Andrew. Doc, you gave the numbers for the first case and the second case, not case, but the first vax and the second vax. The second vaccination numbers, are they included in the first vaccination numbers or are they in addition to? Because if you do the math of the first and the second, it comes up to 8,087. Should I be adding the first vaccination and the second vaccination, or is the second vaccination included in the first?
Well, I wish we could add them together. But no.
So they're not. Okay. That's
And
all
thanks for the easy question. Thank you. But no, the first dose, the 6,000, let me tell you, 6,402, that's
Right.
everybody who had got
Yeah.
the first dose, right?
Right,
And of
right.
those, 1,685 had had a second dose.
Okay, of those. All
We
right,
got them
thank you.
together if you want.
All right, thanks.
Felicia?
Hi. Just continuing on from what Mr. Rogers was speaking about, saying the numbers are there and so forth. But at the same time, I know persons would want to take the vaccine, but again, persons are reading about the blood clotting. We know a number of EU countries put a halt to it. So the concern is there. Persons just want to know the information. But I'm just wondering, Mr. Rogers, right? Reading up, we see that the Pfizer, when you take the 2 doses, you have about 6 months protection, and the Moderna is saying the same thing as well. How much protection do we have for the AstraZeneca? Will we be required to take a booster shot?
No, actually, they're both. I mean, in terms of projecting how long you have immunity, nobody knows for sure. What they're saying for everyone is that it's a minimum of 6 months, it's probably more, and only time will tell. And there's a possibility that we'll need a booster, and if we need a booster, it's likely going to be for all of them. But the truth is that compared to the pandemic with people dying, this is the best way out. It's likely going to be more than 6 months for all, right? So time will tell, and that is the verdict is out for all the vaccines because they've just been introduced, less than a year. So they're projecting and saying it's going to be at least 6 months, is most likely going to be more, but that's the same for all. And maybe a booster, we'll see, and we'll deal with that when the time comes. But I think all will agree. I know we're feeling it for ourselves. I mean, what's worse? I mean, is this what's warranted? This is much worse in being in this pandemic than any consideration of having to take a booster later on or not. So let's just keep things in perspective.
I'd also like to keep one second, Minister. I'd like to also keep the risk in perspective. The risk of these issues with the vaccines are so minuscule compared to everyday stuff that people do. Regular taking of a contraceptive, regular jumping on a plane and flying for 4 or 5 hours, regular having a normal surgery, doing even getting COVID. The risk of these activities are millions and hundreds of thousands of times greater than taking the vaccine. So I think while the risk is there, benefits certainly outweigh the risk. And if you consider the risk of 4 in a million, which is 0.00004% for the first dose only, right? When you consider that risk, as opposed to getting a blood clot, if you get the coronavirus, it's almost up to 40%. The risk of getting these blood clots after contracting the coronavirus is almost up to 40%. So when you look at these things, you have to take these things into context and understand what you're reading and understand what people are saying. So when the risks are certainly there, but the benefits outweigh the risks, then you understand why it's so important to take the vaccine. So when you have a 0.00004% of getting a blood clot because of AstraZeneca, which is 4 in 1 million, Angola doesn't have 1 million persons in the population. Angola basically has almost 14,000 people in the population. So when you work that back to understand the risk of getting this in Angola, it is almost zero.
Thank you. We go across to DJ Hammer. Our final question.
Yes, and okay. Good afternoon to you again. Now, I received a call from the farmers a while ago, about the 4 p.m. cutoff time. Yes, and that is their concern. Some of them are saying that they work through the day and it's best to water in the afternoon time. So that's a concern, folks, that we are getting from the farmers. Another concern that came in a while ago too is the updating of the Beat COVID-19 website. They need to have it updated as well. They're saying for Angolans overseas, it's a vital source of information, and they're saying that it was last updated about April 12th. All right, so take note of that, please. All right.
Thank you very much, DJ Hammer. We're going to wrap up with some closing comments at this point in time. We start with the Commissioner, followed by the Chief Medical Officer, then the PS, and we end with the Premier. Mr. Lynch, Commissioner.
Yeah, no, I'd just like to thank you for inviting me onto the news conference. I just echo the message, really, the Chief Medical Officer and also the Ministry of Health, protecting each other rather than enforcement, and very much about just taking big, sensible actions, stay away from each other whilst we can, and remember the message about wash your hands, cover your mouth, and try and create space around you, and then people will be safe and get vaccinated. It's not so much about prosecution, this is about getting vaccinated and wash your hands, cover your face and stay away from each other for the next few weeks and whilst everybody gets vaccinated. Thank you very much.
Thank you very much. I'll speak for both myself and the Chief Medical Officer. We are both tired and drained right now. What I will say is, yes, we do understand the issues of the 4 o'clock, but we have to understand that this is an existential threat to us right now. We are trying to do this in a measured way. At this point in time, the government has not declared a state of emergency. If we had declared a state of emergency at that point in time, it would be a whole different ballgame. We are trying to meet people as best we can, and we do understand about the farmers, but we ask farmers and other persons who are a little concerned about the 4 p.m., please work with us. A few weeks ago, we would not have figured we'd be here, but we are now here. We have our eyes on the long game, and the long game is to get us out of this rather quickly so you can get back to watering your produce, so you can get back to doing your stuff. But at this point in time, we are actually pleased to work with us so we can get Angola back on track. Thank you very much.
I'd like to, thank everyone for participating and coming out. The Commissioner of Police, the Chief Medical Officer, Permanent Secretary in Health, Ministers of Government, Ministerial Assistants, the media. Ladies and gentlemen, this is a time when we have to prove who Anguillan is and what is Anguillan. We are, we have our own, future in our hands. And this is a time when we have to make sure that we take advantage of this situation and do as the regulations say. We will beat this. And I'm confident in the knowledge, with the skills and response of our health team. And I'm also encouraged and convinced that as a nation, we can pull together and do what is expected of us to stop the spread. We have done a great job for over a year. This has happened, and we have to stop it in its tracks. Otherwise, this can wipe out a population. But as I said, my hope, my confidence is that we will beat this as a people, united together in one accord. And the word is stay home, follow the hygiene practices, wash your hands, cover your cough, avoid people with flu-like symptoms. Don't public gather, get vaccinated. This is what we can do as a people to get past this, to beat this. I know we can, and I know we will. So I want to, thank the fire service yesterday and persons who honked their horns and the sirens, showing solidarity with the health team. And this has been a yeoman's task to get us to this point, and the testing, the surveillance, the monitoring, the vaccination. This is what will help to get Anguilla safe, immune, healthy, and get us back on track. So I'm asking and pleading that we continue to do what is right, and that is encourage persons. If you have symptoms or if you have concerns, call the COVID-19 hotline, and that is 476-7627 or 476-SOAP or 584-4263, 584-HAND. Visit the Facebook or the website at www.beatcovid19.ai. And if I haven't begged enough, pleaded enough, and I haven't made it clear enough, I'll say stay at home, wear a mask, refrain from gatherings, vaccinate, and follow the protocol so we can find our nation recovered from this spread. May God bless you, and may God continue to bless Anguilla. Thank you. 3 o'clock tomorrow afternoon on Tuesday. Thank you.